Codetree Initiative.
Welcome to today's episode. We're diving into a deeply personal and revealing letter from a patient named Lowell Unruh to Dr. Francisco Figueroa, who is the Senior Executive Vice President of Health Affairs at UT Health San Antonio. This letter, written in March 2025, offers a candid account of a complex medical journey following what was supposed to be a routine spinal surgery.
Yes, Liam. What makes this letter so compelling is its dual nature. On one hand, it's a patient's story of suffering and recovery. On the other, it's a clear call for accountability and ethical care within a major health system. It really highlights the importance of understanding patient experience, medical complications, and institutional responsibility in healthcare.
Absolutely. Let's start by unpacking the medical background here. The surgery at the center of this story is an anterior cervical discectomy infusion, or ACDF. It's a common spinal procedure designed to relieve nerve pressure by removing a damaged disc and fusing the vertebrae together. Typically, it's considered routine, with an expected hospital stay of 2 to 3 days.
Right, but in this case, things went very differently. The patient suffered an unexpected complication, a tear or cut to the esophagus caused by the surgical retractor. Now, the esophagus is the food pipe located just behind the trachea, so an injury there is both serious and rare. This led to a hospital-acquired infection, which is one of the most dreaded complications after surgery.
To clarify some of the terms for our listeners, ICU stands for Intensive Care Unit, where critically ill patients receive specialized care. A PICC line, or peripherally inserted central catheter, is a long-term intravenous line used to deliver antibiotics or other medications. And NPO means nil per os, a medical instruction to withhold oral food and fluids.
The severity of the infection and treatment was significant. The patient was NPO for 8 days, meaning no food or drink by mouth, and had to receive heavy-duty antibiotics through a PICC line every 12 hours for a month. An infectious disease physician even warned that it might take a year before the antibiotics could be stopped.
That's a huge burden for any patient. Now let's walk through the timeline of events. On October 14, 2024, Lowell was admitted early in the morning for the ACDF surgery at Texan Methodist. The surgery was reported as completed successfully by just before noon, but what followed was far from routine.
Exactly. Instead of a 2 to 3 day hospital stay, Lowell ended up spending multiple days in the ICU at Texan Methodist, then was transferred to the ICU at University Hospital for further care. The total hospitalization lasted over 3 weeks, with discharge on November 5, 2024.
The contrast between the expected and actual experience is stark. Multiple surgeries were needed to locate and repair the esophageal injury. The patient faced long-term antibiotic treatment and a major disruption to daily life. It's clear from the letter that Lowell was shocked and unprepared for this ordeal.
What really stands out is the tone of the letter. Lowell addresses Dr. Figueroa not to assign blame, but to bring leadership into the loop as a learning opportunity for the organization. He's seeking support in managing the aftermath of what should have been a routine elective surgery.
He also quotes Dr. Christopher Chaput, the head of the Spine Center, who commits to treating every patient as he would a family member. Lowell asks for resources and tools to enable Dr. Jeffrey Hills, the surgeon, to do what needs to be done from both a medical and ethical perspective.
Physician accountability is a major theme here. Lowell stresses the importance of both personal and professional accountability and hopes that leadership will intervene to prevent animosity and potential litigation. The letter references attached documents titled Reasonable Expectations and Dr. Hill's clinical notes, indicating a well-documented case.
There's also a poignant observation from a friend of Lowell's who works on the East Coast. They mentioned that no hospital wants to add to their statistics another hospital-acquired infection. This highlights the systemic pressures hospitals face, which can sometimes conflict with patient-centered care.
That's a critical point. The letter challenges the hospital's public branding, which boldly states, "We make lives better, and best and brightest minds." Lowell acknowledges that UT Health San Antonio does deliver life-changing care, but, in his case, it was life-changing in a very difficult way.
It really exposes the gap between institutional promises and patient realities. Even routine procedures carry risks, and complications can cascade, requiring coordinated responses. The letter is a call for transparency ethical leadership, and patient-centered care.
It also illustrates the power dynamics in healthcare. Here we have a patient reaching out directly to senior leadership seeking justice and healing. There's an emotional burden in medical errors, and Lowell expresses a desire to move forward without public conflict.
Chloe, it makes me wonder, how often do these kinds of complications get quietly managed without leadership really stepping in? It seems like this letter is pushing for a level of transparency and accountability that might not always be present.
That's a good point, Liam, and it's why this letter is so important. It's not just about one patient's experience. It's about how healthcare systems respond when things go wrong. Leadership has a crucial role in fostering an environment where ethical care and accountability are front and center.
To wrap up, Lowell's hope is for a resolution that honors dignity, accountability, and healing. He wants leadership to step in when routine care goes wrong and to ensure patients are treated with the respect and care they deserve.
Behind every procedure is a person whose life can be profoundly affected. This letter reminds us of the human side of healthcare and the importance of aligning mission statements with real patient experiences.
And in the end, Lowell wishes he could be singing the praises of the health system rather than recounting a costly and painful ordeal. It's a powerful reminder for all of us in healthcare to keep patient welfare front and center.
Thanks for joining us for this episode. We hope this discussion sheds light on the complexities of patient care and the vital role of leadership in ensuring ethical, accountable healthcare.
Until next time.